Okay, so welcome back, everyone, and good evening, some of you, and good morning as well, because you all are joining from different part of the world. Thanks for coming in the short period of time. So right now, in today's class, I'm going to discuss the rest of the mental health disorders, and we are going to wrap up today the mental health disorders as well. And I really want to let the everyone know, those who especially come very first time on my channel. So we are right now doing mental health series. And this is specifically if someone is preparing for the NCLEX exam primarily. But if you're also preparing for NORCET as well, this could be also helpful for you to understand the concept. If you do not like psychiatric or mental health nursing, then these classes will be helpful for someone at the same time. Now, we already covered 4 sessions before we begin with today's session. So if you are the first time person watching this video, I highly recommend watch those 4 videos whenever you get some time. And if you ever have questions for me in there, you can definitely ask me the doubts as well. Now, remember everyone, I'm only covering important topics in the online sessions, okay? Only important topics which everyone needs to know and they are repetitive in the exam all the time, okay? But I still recommend everyone, if you do have a Saunders comprehensive book, is a really good book. I always says in my every video, it's a Bible book, needs to be for your content, for your examination. So try your best to read as much as you can. Even after watching the video, you try your best to read some other topics over there also and see if other topics doesn't make sense to you. Maybe you need some help. Let me know, right? How you can let me know? Two different methods. Either you can comment under the videos on the YouTube. You can always let me know, I find this topic difficult. Can you explain it to me? Or the other best way, text me on the WhatsApp. If your exam is coming very closer, just in case, and I'm behind in responding back to everyone because I personally respond everyone by myself. I don't let someone to respond back to your messages. It's by myself. I responding back to everyone. So sometimes if I get behind to your messages and your exam is coming very closer, give me a call. This is something I really want to say to everyone because I have a bunch of WhatsApp messages all the time, but I still try my best to get back to everyone as soon as I can. Okay. So let's get started with today's session. The one thing I really want to say, because some students definitely they know already, but some students they don't know about this one. Just in case during the class, if I left for 5 minutes in between, I'm discussing a topic, just try your best to understand and bear with me because I have almost 1.5-year-old son. So he's sleeping on the other room right now, just in case if he gets awake in the middle of the night, because I'm giving you these classes right now from Canada, and it's a nighttime here from where I'm joining these classes with all of you. So if he gets a wake up, I might need to run only for 2-3 minutes or 5 minutes. So I apologize for that, but I think it's understandable by everyone. Just in case if I leave the class for 5 minutes, then I'll come back again to discuss the topic. Okay. So now let's get started with today's session. I hope everyone brings the book if you do have a book. But if you do not have the book, recommend to buy one if you can. And those who do not have book right now, try your best to make some notes while you're listening me because that will be very helpful for you for your exams. Or you can also just listen me. Okay, if you don't want to make notes right now, let's say you're busy somewhere, just listen me more right now. And you can always watch this video back again on the YouTube if you have doubt or something, you want to make some notes in there. Okay. So let's get started with the first topic because I'm not going to show anything on the screen here today. I'm only going to pull the maybe one of the other presentation just to use something for the rough work, but I'm not going to show you guys the any presentation on the screen today, just so you know, okay? It's only the book what I'm going to follow today, but you listen me more actually. That will be better idea. You listen me more as much as you can. So just give me 1 minute. I'm just gonna share a screen with all of you. So at least you got a little bit a whiteboard with me, just in case I need to write it down, draw something for you guys. It's easy, right? Okay, let me see that. Okay, so this is just the empty slide. I pull it up. There is nothing written in here, just so you know, okay? You can always use your messages as well. Just to see if you do have any doubt, any question, you can always type for me as well. Someone already messaged the first topic, which I'm going to discuss today with the page number for 9th edition, so which is good. So you can also check your chat box as well. It's a page number 976 if someone using 9th edition. So we are going to do the first topic in there, which is the substance abuse, right? So let's get started with this one. The first topic, substance abuse, before even you read in the book, try to understand in simple language what it is, right? Because mental health nursing, I think most of the students, when they find it difficult, you know what is the problem is? You're just reading it from the book. You're not maybe understanding it much, right? So try your best to understand and correlate with the daily routine life so you can remember for a long time. Even after passing your exams, when you're working on the floor, you don't have to go to the books again and again then, right? So, substance abuse in a simple language, if I say, this is something, such a condition, such a problem in which someone take or ingested like substances like drug or maybe alcohol, but they took the drug or alcohol too much into the amount, and that's affecting their body actually, right? One person is on my screen right now. I can see Manveer. You are trying to drawing something on my board right now, my dear. Please, everyone, stay away from my screen when I'm teaching something in between because highly recommend that because I'm not a technical person. Okay. I'm not a technical person that I can mute something somewhere, but I'm just a simple person to teach you guys around it. So please refrain from my screen and let me use the screen as well so I can teach you everyone, but do not interrupt in between because once I make a flow, right, it has to be in a flow so everyone can understand very clearly. Okay, so back to what is substance abuse, the one I was talking about. Substance abuse is nothing. Substance abuse is just like when someone take too much drugs or too much alcohol, you can say. And why I say the word too much, because you actually do use the over, which is a start affecting your body now. Okay, so that condition we call in a simple language substance abuse. Okay, now if you start reading from the book also, if you have a books right now with me, it's very simple language is given in there. They actually mention in the letter B over there that this is a pattern of repeating of a substance which usually result in tolerance or withdrawal effects, or even sometime your patient also have the compulsive drug taking behavior. What does it mean? It means is when someone take these kind of drugs too much, let's say for example heroin, right, or marijuana, right? So when someone take these things too much into them, first of all, they will be having tolerance effect, right? That means they took that amount that they want a more amount after that, and it's affecting their body now. And they're thinking, it's not affecting me, let's take more, right? And that's how they ingested too much. Now, the second thing, definitely withdrawal symptoms will be started. Withdrawal symptoms usually started when they're not getting it when they need it. And usually, most of the, I would say, substance abuse, the withdrawal symptoms usually starts after 12 hours, usually, but it also depends what kind of substance they are refraining from, right? The third thing in the definition, they said compulsive drug taking behavior, which means what? It tells the patient, their mind, their brain, that I must need to take this drug at this time. If I don't take it, something gonna happen to me, right? So this is how their behavior look like in the substance abuse, right? Now, this is again a simple definition, a simple meaning. If anyone has any questions so far, just type it up for me so I can address it for you. Even the students who are joining on YouTube right now, if you do have a question and doubt for me, you can also use the chat box as well, right? Now, substance abuse, they give you a lot of information I see in the book. The only relevant, I would say, for your exams to read is this definition. And then after that, they actually tells you in the point number 2, 3, and 4, which I just mentioned you in a simple language. So you can do the point number 2, 3, 4 also, which talks about if someone taken the larger amount overdose, this is how they get feel like in there, and they feel like desire to cut down those values, but they can't, right? So again, these are repetition things, so I'm not going to repeat it because it's already done. But the most important, something what they highlighted in red in color, you need to know that they said there are some screening tools available by which you can maybe assess the patient condition when they are on these things. So the name of the tool they give it to you is MAST, DEST, and SAGE screening questions, right? These are the common tools which most of the hospitals they use it, but some of them they only have one tool available, or maybe they have their own tool available. It depends in which country you're going after you got your RN licenses, where you're planning to work as an RN. So again, it depends hospital to hospital or site to site, but these are the common questionnaires which usually, as I said, 99.9% people in the world, they still use these questionnaire just to get the history taking or something from the patient, ask information, and try to see where your patient is right now after taking these meds, if they can answer it, right? Now, after this one, they actually give you a bunch of information on substance abuse, like the meaning, factors, dysfunctional behavior. This one I actually don't find much relevant in here, because usually on substance abuse, when you are getting more questions in the exam, this is more around withdrawal symptoms, number two. Number three, nursing interventions. And unfortunately, I did not see in here. So maybe you can add up on your notes on the top of it. So first thing I'll discuss the withdrawal symptoms. Okay, it's not written here on the book, everyone. If you want to write it down, you want to understand, it's your choice. Or maybe you want to write down later as well, or get a notes from me later. You can also do that as well. So withdrawal symptoms is basically, I would say again, it also depends what kind of substance person was taking more. Is that was alcohol, right? Or opioid, like opioid like heroin, morphine, or cannabis, maybe coffee related, caffeine related, nicotine, sedatives. So it could be many other examples, right? But if I want to tell you the shortcut, how to remember the withdrawal symptoms for any of them, the word I use it right now, the shortcut is you will see these patients usually, doesn't matter what substance they use it, when they have withdrawal symptoms, the withdrawal effects, their body actually go on the upper side. Now, what do I mean with the upper side? Like you will see them more restless, hyperactive, irritable, confusion, right? Aggressive behavior. So rather than, they sit on the bed, calm, quiet, you will see them on the opposite side, right? Like this person is going to be more agitative, aggressive, irritable, tremors can be also happen. Fever can also be happen as well. Even they don't sleep enough as well. Confusion can also happen, agitation can also happen. So lots of, like, whichever symptom you will see, everything on the upper side you will see into them, right? Now, if I ask you, let's say, a random symptom, and this comes in your exam, for example, and you are not quite sure, can you find that symptom in there or not? So let me ask you that question, then I will answer it for you. So in these patients, let's say withdrawal effect, are you going to find withdrawal symptom more as on the constipation side or on the diarrhea? What do you guys think? Put into the comment section which answer do you think. I'll check the answers for all of you. And doesn't matter you have idea about it or not, just try your best to participate. Okay. Let's see here. Oh, they said nothing on the screen right now. Okay, you guys can't see my screen? Oh, hold on. I thought I shared it already, no? Can you see the screen now? Just want to make sure. Can you see the screen? It was just the empty paper. I didn't really open any presentation or anything in there. Okay, you can, right? Okay, perfect. I only write it down the substance abuse so far. Nothing really major was in there, okay? So you did not really miss anything. Okay, perfect. Now you guys tell me, for substance abuse patient, I already mentioned that every symptom you will see on the upper side, right? So if I ask you as a, let's say, examiner, like when you see these clients, do you see more constipation into them or do you see more diarrhea into them? So who wants to answer me in here? Let's try your best to type in the messages, please. Even if you want to just make a guess, try your best because as I said, the symptom will be on the upper side. So do you think constipation is on the upper side or diarrhea is on the upper side? Let's see the participation, everyone. Diarrhea, very good. Diarrhea, diarrhea, diarrhea. Yeah, probably more on the diarrhea side. See, right? Why I ask you a random symptom, right? Which is not maybe in the books also. None of the books, maybe they have this symptom in the substance abuse withdrawal effect. Because usually when you're going for any competitive exam, the options, what comes in front of you, this sounds really, you can say surprised, right? And you are like, I did not read that information into the book from where it comes, right? So you should be very confident, when you're answering those type of questions. So that's why I really want all of you to learn this thing with me. Upper symptom, if you know what the meaning is, you can easily pick any symptom of the world in there, right? So rather than low fever, you pick the high fever. Rather than bradycardia, you pick the tachycardia. Rather than bradypnea, you pick the tachypnea. So any upper symptom, basically, that's something you want to check in this patient. Now, this is about the withdrawal symptoms for sure. I make a shortcut key for you, but if you still need a list, let me know later on. I can still send you messages as well in the WhatsApp, like what could be the withdrawal symptoms look like. You can still see the list, but it's still the same, the one I just said. Okay. Now, the next one we have, the one I want to talk about is the nursing interventions, right? Now, again, nursing interventions, I would say it depends upon like the which substance the person is using it, right? But mostly interventions, which I want to say as a brief message in here. So alcohol withdrawal patients, definitely vital signs, everybody know that. But apart from that, the main thing I want to highlight it is about the medication. So in alcohol withdrawal, we will also read as a part of next topic after this. You will see you want to give the benzodiazepine in that case because you don't want the patient to get the seizures as well. Apart from that, you do the seizures precaution, you do the IV fluids as well, right? You make sure the environment is okay around, it's safe for the patient as well, and put the patient on cardiac monitoring too. Don't forget that. Now, apart from this, if I want to tell you brief nursing intervention for opioid withdrawal. So if the opioid is the medication the one person using in substance abuse, then if that person has a withdrawal effect, what you do as a nurse is in there, the main interventions is you want to make sure the hydration maintained for the client, right? So maybe start the IVs if it's required. And these patients usually they vomit more, so antiemetics probably is going to be started. And apart from that, these patients usually feel more when they have fever, they usually have more chills at the same time. So maybe warm environment at the same time as well. And the main medication which you want to give here is the methadone, something that you want to look after for the opioid withdrawal client. Now, a brief message again for if someone is on the, let's say, another common example is maybe sedative, let's say, right? If someone has a sedation, and after that they quit to take sedation, now they have withdrawal symptoms for that, right? So for sedation ones, the main thing you want to check is the respiratory status. Very common that they can easily have the respiratory depression, so you really want to check that as well. Usually when they do the withdrawal, initially they go into tachy phase, but after that they go into brady phase. So keep an eye on with the respiratory and the cardiac, both at the same time. Now, apart from this, definitely you will give some medication as well. So here, main medication, we give benzodiazepines. Now, those students who are thinking, we don't know what is benzodiazepines and the other drugs and so on, don't worry about it, because the next lecture, which is probably tomorrow again, at this time, we are going to start the medications, okay, of the mental health. And everyone, please don't skip the first lecture of medication tomorrow. You can skip the part 2 if you want to, but not tomorrow. Why? Because tomorrow, before we start the medication, I'm actually going to tell you a way how to study any medication for your nursing exams, right? Because that method helped me a lot, to remember, recall any medicine without reading again and again. So I'm going to tell you the easiest method, like how to remember the meds. Okay. So that method I'm going to discuss first in tomorrow class, and then we will continue with the meds after that. Okay. So tomorrow, the first part of lecture is very, very important. Try your best to attend the first part if you can. Okay. Now, these are the common nursing interventions, as I said, in these clients when they have these kind of the withdrawal effects. Now, some of the messages I can see on the screen. Let's see here. Okay, just want to make sure there is no doubt from me. Okay, so we're done with the substance abuse topic, everyone. As I said, nursing interventions are not written in the book. Withdrawal symptoms are not written much in the book. Try your best to write it down, make your own notes for that, the one I just mentioned it. And any questions so far until now, you can use the chat box, let me know. Or if the topic is clear, just say clear for me so I know you guys are clear with that and I can move on to the next topic right away, right? Now, perfect. I can see some responses. All clear, all clear. Very good. Now, the next one we have is the alcohol withdrawal, right? So, alcohol withdrawal basically is not a separate topic, just so you all know. I know in the Saunders book, they give you as a separate topic. It's actually right next to the substance you will see in the same book, the where you just open your page number with the substance abuse before. So basically, alcohol withdrawal is not a separate topic. I know the books give you separate topic, but it's actually a part of the substance abuse. That's why I did not discuss much alcohol about it before, because I want to talk about now, particularly about alcohol related, right? So alcohol withdrawal is what, right? I think the word already indicates, right? When someone drink too much alcohol and after that they suddenly quit taking alcohol, right? There's something gonna happen to their body. That is we call alcohol withdrawal, right? So alcohol withdrawal, if you see from the books, what could be the early symptoms, right? I'm just going to use your book as well, just to show you the brief idea of how to use the Saunders at the same time, because so many students ask me how to read the Saunders book. So this is how you read the book with me. So early symptoms of alcohol, they said, of course, if someone of not drinking alcohol anymore, the stomach is going to be upset, right? So nausea, vomitings, right? Pretty common. They don't feel like to eat anything as well, right? And then more anxious, more anxiety, right? And easily get startled. What does it mean? So alertness, this is something easily get startled means like, let's say, you want to, let's say if I'm your patient, alcohol withdrawal right now, you say something to me and I just be like that right away. right? Because something ongoing right now in my brain at the same time, because I'm thinking about alcohol maybe as well, right? So I have that kind of behavior, give you a reaction, whatever you say something to me. And that reaction is usually on the bad side, right? Maybe I will fight back with you. So hyper alertness, hypertension, see, everything is upper symptom. We don't need to read that. Like all are the upper symptom, not a lower one. Insomnia, you don't get a sleep enough as well. Irritable, jerky movements like shaking kind of things, right? Shaking your hands, shaking your body, those are jerky movements. And possibly experiencing hallucination, illusion, delusions, also very common, right? And possibly reports of feeling a shaking inside. Sometimes the patient also might gonna tell you, I feel something inside my body is moving, it's just shaking, especially in my tummy. This is something they will tell you, how they describe you. And patient might could be at the risk of seizures as well, right? Usually they said the seizures could be at the risk around between 48 hours after they stop taking alcohol. So usually within 48 hours. And tachycardia tremors, again, upper symptom. See, when you study in this method, upper symptom, you don't have to cram the list of the symptom for sure for any nursing exam which you're writing down, right? Because it's in your brain that this is the upper symptom, right? So it doesn't matter what upper symptom they give you in the exam, even if it's a select all the reply question, you can easily pick it up the answer, right? Now, moving on to the next part of the alcohol withdrawal, let's see what else is important in here. They're actually talking about the withdrawal delirium as well. Now, what is withdrawal delirium? Let's see that. So, withdrawal delirium, they said it's a state of delirium, usually peaks 48 to 72 hours after cessation or reduction of intake and lasts for 2 to 3 days. What does it mean? Usually, okay, who knows what is the meaning of delirium? Because I teach few things yesterday in the previous class. Anyone knows the meaning of delirium? You remember something? Maybe even one word you want to type up for me so I can move on. Anyone? Delirium? What's delirium? We discussed yesterday delirium, dementia, Alzheimer's, right? See if you remember something. Acute onset. Very good. Very good, Tessie. Okay. Any other? Any other student? Confusion, sundown. Very good. See, you remember a lot now, right? Good. Reversible. There you go. Sudden. Seems like everybody attended the class yesterday. Good. Now I can see you guys are studying. So thanks for responding that. Now they said withdrawal delirium, confusion, acute confusion will be in here. And this is something very common within 48 to 72 hours, and it can stay for a few days as well. And usually what happen in here is the patient symptom, whatever they get, it's actually more on the upper side, right? So more you can say disorientation, right? Level of consciousness is also factoring in here. Very, very high fever. So which is not good, right? More hallucination, more delusions, right? More tachycardia, more high blood pressure as well. So you can see it's a medical emergency for sure if it happens, right? This is not nice. So we need to look something in here. So what else you need to know about alcohol withdrawal? Alcohol withdrawal, what are you going to do as a nurse, which is your nursing intervention, right? So if I read it briefly again from here, they said, make sure you check your patient always frequently when your patient is inside the room, right? Because you want to see the symptom if they're getting same or they're getting worse, right? And then neurological signs, you really want to check every 15 minutes because you want to see if the patient going into delirium or not, right? Everybody know vital signs is important, but I would say neurological is also important, which comes first even before you check the vital signs here. Now, apart from this, if ever you notice any of these things is changing a lot, highly recommend one-on-one supervision now start for this patient right away. And quiet, non-stimulating environment, very, very important, right? And always when you see this person, try your best to talk in a quiet, calm manner. Don't talk too loud voice in a rush with this person because they really want a quiet environment in front of you. If you become too much fast in front of them, they might can become agitated at the same time. And apart from this, very important, seizures precaution. And you really want to look around the administering the anticonvulsants medication if it's required, if it's prescribed by the doctor. And apart from this, they're not eating enough, right? So make sure after the antiemetic, see if the patient want to eat something. And if they want to eat something, give a small amount of food. Don't put too much on the plate at the same time. So small, frequent food is a great idea. And I would say high carbs, high protein diet because they're hardly eating something, right? More fluids if they can, if the doctor are not stopping for some other medical reasons at the same time. So give some fluids also, right? And apart from this, yeah, I would say assist the person in their daily life routine activities because sometimes they cannot do all those, even the normal things as well, like toileting, bathing, shower, brushing. Sometimes it's hard for them to do it. So if you can assist them as a nurse, it's a great idea because your patient might also be at the risk for fall also. So this is something you really need to look as the nurse in this case. So now we are done with the interventions. In here, what I have here in the book, very briefly, before we wrap up this topic, they actually give you some name of the medications, which you can actually give to the alcohol withdrawal person. The most common one is the, I would say, disulfiram, which a lot of nurses might heard it. But apart from that, you can also do the naltrexone, and then a camprosate. And yeah, that's it. So those are three common, right? So disulfiram, naltrexone, and camprosate. So this is how I pronounce it. Maybe you pronounce it in a different way as well. So that's okay. But I hope everybody have the book, you know, the spellings and everything. You can let me know if you don't have, I'll just type it up for you. And this is about this topic now, overall, what you look in the alcohol withdrawals. So see, we covered substance abuse together along with the alcohol withdrawal now. Now, what is the next we're supposed to do it today? Let's see that. The next topic, let me pull my list. The one I sent you before, guys, in my WhatsApp. So the next list I can see here is abuse topic we need to discuss now. And there was another topic there which I highlighted before as well in the WhatsApp earlier. So those students who joined the group 1 month ago or 3 weeks ago, they know which list I'm talking about. So I also mentioned at that time neuroleptic malignant syndrome, right? Neuroleptic malignant syndrome, I'll talk about it when we discuss antipsychotics. So at that time, we will discuss together because it's actually a reaction from antipsychotic. So it's better to discuss at that time. So we only left with one topic now, which is abuse topic, but it's a little bit longer topic, which you need to know, right? So now let's talk about the abuse topic. So in the abuse, we have child abuse, we have the older abuse, right? So those are two different topics you will find into the book. If someone has a 9th edition, please type the page number for me for the other students. It's actually in your chapter. If you go to the next chapter, in the, let's see here, crisis theory and intervention chapter, and you will find in there a child abuse and also the older abuse, right? So both of them, I would say, whatever given information in the book, that is also a little bit okay, important. So skim and scan, I would say, is a great idea. But something which I feel like you really need to know after that, which is about abuse strategy. Now, what do I mean with abuse strategy? Abuse strategy is basically when you get a question on the abuse, you know, this person with this age of the client come to the hospital emergency, you are the RN there today, you notice this bruise and so, what are you going to do first, right? So, you know, when you see the options, everything sounds good, right? So what to do first in that situation? So for that reason, I have my own created abuse strategy, right? So which I think could be very helpful for a lot of candidates, right? So if I give you that strategy today and you write it down, and I'll show you that strategy on my screen also. I already have the document ready for that. So try your best to use that strategy into the next time in any abuse related question. Any abuse means scenario type question, what to do first, okay? But if it's a knowledge related question, maybe they're asking you types of abuse, that is a knowledge question. So you can't use strategy in that question because it's a bookish type of question, right? So first we will skim and scan the one something in the books as a part of content. Then I'll give you the guys the strategy, the abuse strategy after that. Okay. So let's see together. So in the book, they actually give you the definition and they give you some symptoms. What are you going to check in child abuse and the nursing interventions, right? So if I want to talk about the definition in the book is pretty much lengthy definition. Make it simple for yourself. Don't read too much definitions in there because you just need to know meaning. Child abuse is what? Child abuse is nothing. It's basically any action or any behavior which put a child like physically, emotionally, mentally harm, right? Or a neglect with that person, right? So this is something we call child abuse. So for example, if I have one child in front of me, right? And I'm harming that child intentionally, neglecting it. I don't want to give the child food, let the person cry. And it's definitely affecting physically, emotionally, as well at the same time, and mentally as well, right? So that is we call what? Child abuse, right? Why I want to say this topic is very, 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 very important for the exams, especially if someone writing the NCLEX exams, doesn't matter NCLEX RN or NCLEX PN if somebody writing down, because we take it very seriously. Abuse is in here. So even when you start working as an RN on the floor in the country like USA, Canada, Australia, if you notice abuse somewhere on the floor, even with an old age person, with a child, or even with the elderly, anybody, right? You must need to report it as a nurse. Okay, so this is very, 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 very important because if you don't report it, it will come on your license at the same time. And also, abuse is kind of very serious thing. We take it in here, even if it's, let's say, not in the hospital, it's happening in someone's house here. Police get involved also. Court cases will be involved too after. And definitely family need to be questioned and answers as well after that. And the governments here, they make sure whoever person is like involved in the abuse, maybe woman, child, or man, it could be anyone, right? They make sure that person stays safe somewhere. So that is why if these things are very important in these countries, that is why NCLEX love to test these type of questions. So easily, I would say 1 to 2 questions, very important abuse topic. So listen very carefully, everyone. But if someone is preparing for the other license exam, let's say NORCET or any other, still it's going to be helpful for you too, because you must need to know about the abuse, right? So this is the meaning of child abuse, the one I talked about earlier, like what is a child abuse meaning is, right? Now I'm going to talk about some different type of child abuse very briefly, right? So we have physical abuse. Physical abuse means you're harming a child. Maybe you're kicking them, slapping them. So I know in countries like I'm originally from India. I know in India and also in Pakistan and other all neighboring countries in Asia also, slapping, scolding your child is very common, right? But believe me, these things are very hard when you go to any other country apart from these, right? Because these count as an abuse. So if someone see this is happening in your house or in a society, in a public place, you're trying to slapping a child in there, you're trying to scolding your child even also, even you did not touch the child, you say something really louder. This is still count as the abuse. Okay, so everybody needs to be very careful, especially those who are planning to pass the NCLEX and after that they're planning to come outside to the abroad. Okay. And also, I think even in India, Pakistan also, this should not be happened because this is count as the abuse. Now, other examples of physical abuse is like, you're shaking your child. Maybe you try to throw away your child and your child get a physical injury, maybe from a furniture, let's say for a fracture or something, right? Even they got a bruise somewhere. That is we call the physical abuse as well. And apart from this, the next one we have common type is emotional abuse. Emotional abuse is basically, when you are trying to ignoring your child, you don't want to look at that person, or you're trying blaming your child constantly again and again for something, pinching out something, that is emotional abuse. Pretty common. Threatening, that is emotional abuse too. Um, because in that case your child will actually can go into depression, right? And also feel more anxious, so they don't perform well into the school performance also. Now, the third one we have is the sexual abuse, right? This is the third type of abuse. Sexual abuse, definitely common examples like touching the private part of the child, right? And then maybe exposing your child to a private videos, which is not good for them to watch, right? And then maybe it's a rape case as well with the child too, or maybe you're sharing some bad words, secret, talking about same thing with the child, right? So these are the common examples of the sexual abuse. And definitely, how do we know the child get affected with that? If the child shows some signs of the, maybe they show you some signs of like genital injury, right? On the assessment, you notice as a nurse, like some genital injury happened there, right? Or maybe the child is showing you some knowledge about sexual behavior. So that is also count as the sexual abuse. I hope everyone's still with me. You are learning. So let's move on to the next type of abuse. Next type is neglect, right? Neglect is what? Common examples. You don't want to give a food. You don't want to give clothing. You don't want to supervise the child because you're thinking your child is all okay all the time, right? Or maybe something happened to your child, like a symptom or something in the home, maybe cough, fever, or anything, but you don't want to take it to the doctor because you just want to ignore, neglect it, right? So it could be any example. Maybe your child says, "Can you come and play with me?" You're neglecting it. Your child says, "Can you do this homework with me from my school?" You're neglecting it. You don't want to do it because you're busy, maybe in doing some other things, and you're neglecting actually intentionally, not unintentionally, intentionally, because you're thinking your child can handle everything by themselves, right? Now, how do you know a child has a signs of neglection? How do you know that, right? You basically look. Someone commented here, chlamydia infection in the child. Yeah, that could also be possible. Yes, Raki. Now, in neglection, you see the signs like malnourished, right? Malnourished. If you see a child, that could be a sign of neglection. Maybe your child is wearing like dirty clothes, right? All the time, sign of neglection, right? Poor growth as compared to the what the growth supposed to be at that age, again, it's a sign of the neglect as well. So these are the important ones. Now, briefly, nursing interventions before we go to abuse strategy quickly. So briefly, nursing intervention, I would say the most important nursing intervention is the mandatory reporting. As I said, you must need to report as a nurse. And where you report, how you report, I'll talk about again in the strategy. I'll pull it up very soon for you because the strategy exactly tells you how you can handle the question in what way and where to go. So just give me 2 more minutes. I'll take you on that document very soon. And then documentation is very important as a part of your nursing intervention. So don't forget to document what you see, what you notice, what the parents tell you, what the child is telling you. Everything you need to write it down, right? And then interviewing the child if possible. And this is, you can only do that if the child is in that age group where they can answer you, right? Again, I'll talk about this in the next slide in the strategy, because it depends from what age to what age, right? So when you do the interview the child at that time, right, make sure you separate the child from the parent if possible, if the child has grown enough, right? But if the child is very little, maybe they want to stay with the parents, right? But when you're interviewing the child, make sure you do ask more open questions. Try your best to ask such a question where the child can give you more information about the abuse. How does it happen in the house? Is the child feeling scared right now? Did mom and dad something tell you, like not to tell someone, right? So those are the simple questions. You're gonna ask something in there. And try your best not to start with the direct question when you interviewing the child. You in the beginning, ask the child normal question. How do you stay at home? Where do you live? Do you live with mom and dad? How's your mom is with you so far? Is she doing good? So ask the general question for what do you guys do all the day? Do you guys play something around, right? And then after that, ask the direct question when needed. So don't start the conversation with the direct question. Direct question come later on. And then safety, very important as a part of nursing intervention. So you need to make sure the child is safe, always away from danger. So if you, after collecting the information, if the child is telling you something, you need to make sure as a nurse, you do something to save the child further, not to send home. Okay. Again, I'll talk about in the strategies as well. All these points will come over there too, but I'm just telling you brief idea right now. Yeah, that's all I can see with me about the nursing intervention so far. Now, regarding the older abuse, it's still same. The only difference is, the example could be different, like in the older person. So child examples are different in what type of abuse is happening. Older examples are different in physical abuse, emotional, and other, right? The only differences comes in the examples, in the types of abuse, and also a little bit in the nursing intervention. Nursing intervention, I'll cover for the older abuse person pretty much in the strategy right now. But if I want to tell you a brief idea about the symptoms, the example of the types of in the older abuse, not a child abuse, older abuse I'm talking about right now. So for example, how do you know older abuse had a physical abuse? When you see they have burns, pressure sore, more wound, abrasions, bruises, sometimes they have fracture, physical things. Or maybe they start crying and they are crying continuously, right? Sexual abuse, common example, difficulty in walking, maybe, right? Or maybe discomfort in the genital area. Or maybe their clothing is torn right now. So this is what you notice maybe suddenly in there. And sometimes they do have genital infection, which is unexplained sometimes, like why is it there suddenly? In emotional abuse, in the older abuse I'm talking about, they usually get more confused at that time, more fearful from someone because they don't want to talk about it, more agitated behavior. And sometimes they don't eat enough. So change in weight, you will see that they lose the weight also. And they're gonna withdrawn from everything, like losing interest from everything what they usually does in the morning routine or afternoon routine or evening, because they're not happy anymore with their social life maybe now. And if you see some signs of neglect into them, you will see neglection sign is more related to, especially related to dehydration, malnutrition, very common in the older one, lacking physical needs. Like they have glasses, but the glasses is not being fixed. So where the glasses are right now, this is something you want to see where the glasses are. You used to wear that, right? Even the dentures, you used to wear dentures, but not anymore now. Where's your dentures? Or maybe you have dentures, but it's not been fixed. Is someone neglecting to be fixed, to make it fixed? So this is something you want to say in there. So these are the common signs what you want to check in the older abuse at the same time. Now I'm going to quickly jump on to my other screen where you will see with me the strategy, abuse strategy, which I'm talking about. So just give me 1 minute for that. Let's see here. I'm just gonna stop the screen sharing for a second. Hold on. Are you still guys able to see the screen? Because I can see it's not being shared. Can you see the screen still? Yes? Okay. I don't see on my end, maybe. Maybe some problem on my end. That's okay. Can you just give me guys 5 minutes? I'll be right back. Okay. I have to go and see my baby quickly. I'll be right back in here. Thank you. Okay, let's see here. I'm back, everyone. Sorry for being away for a few minutes. Let's get started. So let's see here. I can see. Because I'm looking to share the screen right now. How come it's not visible on my end? You guys can still see my screen, right? Okay, how about now? I try to switch it. Can you see an abuse strategy in front of you? Maybe just tell me in the messages yes or no. That would be great. I already switched my screen to the abuse strategy. Can you see that or no? Anyone? Okay. Yeah, now it is visible. Okay, perfect. Just want to make sure. Okay. So abuse strategy, first of all, this is only for exam purposes. Okay. This is not when you go work as a nurse on the floor, because when you go work as a nurse on the floor, you also need to follow your hospital policies where you're working or your site policy, right? And it also depends which country you're going to or where you're working, everyone, right? But this one strategy, I actually make it only exclusively to handle abuse related questions. Any question I can tell you can be handled easily with this one for your NCLEX RN or for your NCLEX PN. Same for mains NORCET. Mains NORCET. These questions can easily tackle with this strategy. Mains, not the prelims I'm talking about, because it's more factual information in there. And that factual information you need to read from the book, the one I just said, right? But if they're asking you the questions like in any of these exams, what are you going to do first, right? Then definitely this strategy is going to be very helpful for you. Either you can write it down, either I will share this document right after the class in the WhatsApp group so you can access it from me. Or if someone watching this video later on the YouTube, you need this document, let me know. I'll try my best to put it under the description on the YouTube also so you can access it all the time, right? But listening is very important, everyone. Okay, rather than making note right now, listen me more what I'm going to talk in there. Okay. So first of all, I actually create this strategy into two different things. Okay. The first thing I want to highlight it here is, let me see here. The first thing I want to highlight it is inside facility. Okay. The second thing I'll talk about it later, which is outside facility. Now, what does it mean inside facility and outside facility? So inside facility means if you get a question in your exam and it's related to, like, they bring a patient in front of you and you're working in hospital, a clinic, maybe it's a nursing home, it could be any site, but it's a facility where you're working, and they bring the patient there and they give you some signs of the abuse. It could be signs of physical abuse, emotional abuse, financial abuse, like any kind of abuse signs, basically. But it's inside facility, they bring the patient. Okay. In that stage, first of all, you need to look the age of the patient. Okay. I never usually say look at the age in all those type of questions in the NCLEX or in the NORCET mains as well. But this is an exception area where you actually need to look at the age for sure, because it depends upon the age of the client, which action you're going to take. Okay, so I actually divided this age into four different categories. Number one, I'll discuss the one who are 5 years old and less than 5 years old. Okay, the second I'll talk about it after is who are between, they're 5+ now, but it's 5 to 11, like 5+ and then until 11 years of age. And the third category I divided by myself, which is someone who is 11 years old plus, but up to what age? It could be any age. Usually I say until 60, 65 when they are cognitive enough, because majority of the time when someone hits 65, after that their cognitive level start declining it. Or maybe they're still, let's say in your question 55, 60, but they already give you diagnose of the patient that they're not cognitive enough. Maybe they already tell you patient has Alzheimer's, right? So if they already tell you not cognitive enough, you want to put them into fourth category, not in number three. But if the cognition is still good or less than 65, you want to put them into this category in the number three. Okay. The last one, I'll talk about it later on, as I said, especially if someone crossing age 80 plus, right? Or this person is not cognitive enough anymore. They give you clue into the question, why not cognitive enough? Or maybe they clearly give you diagnosis in there as well, right? Which tells you the person is not cognitive enough. Now let's go one by one, okay? So the first one, if you got a patient in your question, right? And as I said, this is only for exam purposes strategy, based upon my experience, what I see to write it down these things. So if someone is age 5 years or less than 5 years, okay, they come to the hospital to you and you notice some signs of like, abuses in there. Usually in this age, physical abuse is pretty common or neglection, right? And if they give you that signs, what are you going to do first? Because they usually come with the parents, okay? Don't forget that. Now, the first step is definitely collect history, okay? But from where you're going to collect the history? From parents. So if they already give you option, collect history, go with that answer. But what about if collection of history already done into the question now? Now what is next? What is the first step now? Then you look at the second step of that, right? If the collection of history is already done, then you basically simply do what? Report it. Now remember, this is very important here, irrespective what the parents tell you. Oh, my child fall from tree or fall, tree or the fall from the bed, or maybe it's just happen in the house. It's not our fault. Doesn't matter what the parents are telling you in this age group. You must need to report it, everyone. Okay, because child, it's a very minor age, and this is your job to protect the child, right? So what we do in that case, you need to report it. Doesn't matter confirm abuse or not, right? You still need to report it. But where you are going to report it, very carefully look, everyone. Okay. The first answer, which you want to find out in reporting section in your answer keys, you always report it to the authorities. The child abuse authorities, or they will give you word child health agency, or they will give you word child protection services. Okay. These are the names of that authorities where you're reporting. Now, a lot of students must be thinking who these authorities are. The way we have ambulance, police, fire, those kind of things, the fire brigade, the one we have, right? Similarly, you have these authorities also. So it's like a separate building, right? But those people work in there, so where you have to report them. Now, what is their job when you report it to them? Their job is to do further investigation to this case, and then they will follow up even when the child, let's say, in case the child go home after this with the parents. So they will follow up after this from today and look into the situation, try to figure out what's happening in there and why, right? So this is what we call what you do if the age is 5 or less than 5. So reporting, always authorities comes first, or child protection services or child health agencies. These are the different names, but it's the same thing. Now, where do you report it next? You report to the charge nurse next. Don't go to charge nurse right away. Why? Because this is every nurse job, to report it directly by themselves. If you go to charge nurse, what's she gonna tell you? He or she gonna tell you what? Did you report it? Right? Same thing. So better not to go to them first. You need to do something first by yourself as a nurse in that situation. And then you simply let the charge nurse know on the floor what's going on in there. But charge nurse will come later on. Agency's authorities comes first. They need to know first, right? And definitely documentation at the end for sure. I hope it's clear with everyone. It's not very confusing for sure. But you can let me know in the chat box if it's clear or not, right? So I can repeat it again for you if something not clear, right? Okay, I can see some messages clear. Okay, everybody clear or not clear? Okay, clear. Okay, good. Now we're going to move on to the next one. The next stage is 5 to 11 years. So 5 years plus, okay, until age of 11. What is the difference in this case? The only difference here is basically when you collect the history as a first step from the child, you took in a private room here, not in the front of the parents. Okay, this is very important because they can answer you, you know, and definitely they can be in a private room as well. Just simply tell the parents, we need to talk to the child in a private room if you are okay with that, right? So they will be like, okay with that too. So you just stay with the child in that room and the parents will leave the room and you took all the history what you required. And then after that, everything rest is same exactly. So nothing is changing in here. Reporting, you're gonna do it for sure here as well. Does not matter the child tell you truth or not. Maybe the child is, scared, they did not tell you maybe much about it. Or maybe the child says, no, it's nothing happened by my parents, right? So it doesn't matter what they tell you. You still need to report it. Why? Again, the age is small, right? Age is minor, so you still need to report it in this case. And how about as an LPN, ma'am? Yeah, you still need to report it. So even if someone writing down the LPN examination, let's say for NCLEX PN or REX PN, CPN, RNE, or even after you got the licenses, you go at the workplace as well. You always go report to the authorities first. And then after that, you let your charge nurse know. So for LPNs, the charge nurse is RN. So you let the RN knows after that, then this case. You only collaborate with the RN first if you are in doubt. If you're not quite sure what to do in that situation, you're not quite sure if this is something abuse or what, right? Then you can definitely collaborate in that case. But for questions perspective, for examination perspective, definitely you can report it by yourself, you can collect the history by yourself, and you can let the charge nurse know later on as well, right? So I hope I addressed the question for this person. I don't see your name in here. It just say iPhone, but I hope I addressed this question for you. Now, moving on to the next point we have, the next point is 11 years old until they are cognitive enough, as I said, right? Now, here, what's the differences? Let's see together, right? The first step is same as what we did in 5 to 11. So you collect the history from them, from the patient itself in a private room, because they can answer you, right? And we also come in this age group as well, all of us, because we are cognitive enough and we are in this age group. We all are 11 plus and we are less than 65, right? So definitely you come in this category. So collect the history first, very important. And then after that, reporting is different here, everyone. Okay, that's why I highlighted here. Here you only report to authorities and charge nurses if the patient tell you it's an abuse. But if the patient tell you it's not an abuse, in that case, you only follow up later on when they go home. You follow up, go home as a home care nurse or send someone, right? And document about it, right? So why we don't need to report it here? Because the simple answer is, let's say, imagine on yourself. If you are my patients here, everyone, right? And I'm telling you, hey, I'm going to report it. Doesn't matter it's an abuse or not. What are you going to do with me? You will definitely punch me or get mad at me. You will be like, I know what I'm doing. I know what I'm saying. Why are you reporting me? I told you this is not my husband problem. This is not my wife problem. Nobody doing abuse with me in the house. I told you already, right? So we are in this category. Similarly, right? Is your patient also. So if they tell you here it's not an abuse, please guys don't report it. But yes, you still have to do something. You only follow up and document. Follow up is very important here. Okay, I hope everyone is still clear here with me. Now, moving on quickly to the next section. The next section is let's see here. Hold on, how to go down. Okay, I'm gonna find eraser first here, sorry. Okay, so the next one we're gonna talk about the 80 years old or non-cognitive or Alzheimer's patient if they already give you diagnosis, right? So in this case, what's the difference? This is just like your child, I would say. You collect the history, but in private area because they are old enough. They don't need to be with the family members. You can ask them question in the private, even if they have Alzheimer's. Always think about the client rights as well, right? And definitely you report it still here. Now, this is the difference in reporting. Here, the reporting is just like a child. You still have to report it. Even does not matter. Sorry, it's not a mother here. Maybe I typed the mother by mistake here. Just give me 1 second, everyone. This is not a mother. So reported still does not matter the patient confirm abuse or not. You still need to report it. Okay. Now in the authorities, again, this is not a child. I'm going to change my words is in here. In authorities, when you're reporting it, this is we called older protection services, elder protection services, depends what is the age of the client look like. And also, sometimes they give you word like the abuse health agencies or abuse authorities. So all those are same meaning, right? So you don't have to say child in here. Sorry, I didn't by mistake type it this one, but you can take it off by yourself if you do understand. But yeah, reporting is very important here. Now, why reporting in this age group, right? Because elderly, most of the time, even if they know what they're answering at that time, you still need to look after their safety, right? Because sometimes we don't know if they're cognitive enough in this age or not. So for safer side, we need to report it so we can just follow up easily, right? So this is what we do in the inside facility. I hope everybody understands so far. You're learning with me. You were almost done. 5 more minutes only. Okay. So stay with me around only for 5 more minutes. Now, the next one I'm going to talk about quickly here is the outside facility. Okay. Outside facility. So in the outside facility, basically, what is the meaning of the outside facility? Outside facility means you get a question in the exam, but this is not something they come to you in a hospital or clinic. No. Maybe it's a parking area, it's a public place, it's a shopping mall. It could be school also, right? As a part of example, I already put it on my screen. But it's not a site, a facility, right? There it's a little bit different, right? There we don't have charge nurse role. There we have more physician role, right? If you check above with me, if I take you above on the screen with me, I think I forget to mention you one thing over there as well. So let me see that together. In the inside facility, where does it written? Oh, here. No role of physician in reporting section. Why? Because it's already in facility. Physician will still come for the treatment, right? They still know, and you still let them know as well as a part of team member, and they will still treat the person, right? But why reporting is especially a part of requirement in the outside facility? Because physician is not there, and you need to take this person now maybe for the admission, to the hospital. So if I again talk about this age group, so here I actually divide them only into 3 sections. Okay. The first one, make it easier again, 5 years, less than 5 years when they're going to school, right? Let's say it's a school example, child. The first thing when you take a history, right? You take a history from the parents. And of course, parents are not in the school, right? So you might need to call them, right? Or maybe they're not in the public area at that time. But if the parents are around, then definitely take in person, but in a private area, not in front of the public. Okay. Now, again, doesn't matter they confirmed it or not, you still need to report it, just as you do above in the previous section, because you want to look at the safety of the child. Now, here reporting is a little bit different in the outside facility. The only difference, as I said, no charge nurse role, doctor's role, physician role here. So here, authorities comes later and physician comes first because you want to get the order to take the person to the hospital first, get them admitted. Doesn't matter, it's a minor injury, no injury, or just little bruise. You still need to look after, do some admission assessments, right? So you need the doctors in this case for sure as a first person to let them know about it or get the directions what to do, right? And then once you got the time after that, then you let the authorities know. And automatically after letting authorities know you already in facility now, then also let your charge nurse know also, right? As a third person, because you already now go to facility, right? So I hope it's making sense for everyone now, right? It's not that confusing. You revise this document back again, listen my video back again. It will be very helpful in answering some questions. Now, moving on to the next age group, 5 to 11, right? First, definitely collect history, right? Collect history from the patient itself, not from the parents, because patient can answer you in this age group pretty easily. And we don't know if they're telling truth or not, or they're getting scared. You still need to report it. Now, again, same reporting. In this case, physician first, authorities comes later, right? Similarly, you have third last category, 11 years plus until whatever the age they want to go to school. But they are cognitive enough in this case because that's why they're going to school, right? So first one in this case is collect history. And history you will collect from the patient itself in the private room. Okay. And after that is the reporting, right? Now, reporting when you do here is in reporting section, physician comes first, right? And then authorities comes later on, right? And if they say no to you, this is not an abuse, please don't report it. Okay. You only report it if they said abuse to you. But if they said no, this is not an abuse, right? Then definitely you follow up and the document it, right? So I hope it's pretty simple. It's pretty easy. It's not that complicated, I guess, right? Now, this is all about for abuse topic, and this is all about for today's session as well. If anyone has any doubt, any questions so far for me, I'll give you guys this document after the class. Either I'll put it in the description box on the YouTube, or maybe I'll send you on the WhatsApp also, whoever are joining from the WhatsApp. Okay. Any questions for me, please, before we leave today? Yeah, no worries, Brenda. Yeah. Any questions, everyone, before I wrap up the today's session? Yeah. Even I would also suggest, as we just did finish the mental health most important topics, try your best, everyone, to maintain the consistency and study more. And I know a lot of students, they also mentioned earlier in one of my poll on the WhatsApp, they said they have problem in motivation and consistency. So I'll bring something on that for sure. Maybe after 1 hour, I'll come online, guys, for 15-20 minutes. If someone has a doubt, questions for me regarding their preparation, they can ask me. Okay, so I'll send you another link after 1 hour, hopefully, before I go to my bed today. But yeah, for now, if there is any doubt, any question for me, that's something I can address about the mental health condition, what we just discussed. Tomorrow lecture, don't miss it. It will be on medications for sure. Any questions so far, everyone? All good? Are we good for today? I don't see any questions in here. Let me check if there is any question on the YouTube. YouTube students, no question for me? Okay, nothing on Zoom question, nothing on YouTube question. Seems like it's clear for everyone. Okay, perfect. Okay, well, thanks for joining the session today, everyone. I'll let you guys go now, and I'll see you guys again for sure in the next class tomorrow. And those who have a doubts for me, see me back again for a few minutes after an hour. Okay, thank you so much.